My name is Sarah Welch, and I'm a rad tech at Shriners. For a while, we've been doing ultrasounds for ganglion cysts that can appear on hands and wrists, and also some of our children who have magic rods inserted in their back for scoliosis. We do some measurements on that to make sure that we're growing those magic rods in the right way. We wanted to add hip ultrasounds for babies who may or may not have hip dysplasia. When a baby is born, there's several risk factors that can lead to concerns about hip dysplasia. If the patient was breached while they were in utero, if they happen to have been the firstborn female, and if there's low fluid levels during the pregnancy. When a child is under the age of 6 months old, their bones have not hardened enough, ossified enough to make them visible on x-ray. So we could take an x-ray, but it doesn't really give us the right information that we want for a child who may or may not have hip dysplasia. Ultrasound can see the cartilage before it turns bony, and then we can confirm or check to see if they have hip dysplasia or if they don't. So having the ultrasound is critical in diagnosing that hip dysplasia. It's the gold standard of diagnosis for babies under 6 months old. It is much easier to treat and less invasive to treat if we treat them when they're under 6 months old. So having the ultrasound here at Shriners means that a patient can come in with a question as to whether or not they may have hip dysplasia, and in a couple of appointments, we can diagnose it, get them in a harness if they need to be in a harness. Having it all in one location is super helpful. We have this new ultrasound room. We were able to decorate it in a way that we felt was kind of cozy and calming to both the parents and the patients. You know, we're scanning patients who are under 6 months old, so we have to make sure to pay attention to the parent experience also as the baby experience. So the lights, the mobile with the music helps distract the baby and give them something fun to look at while I'm scanning their hips. At Shriners, our only goal is to make sure that the child has all the care that they need and everything that they can